as today looking at the government's performance when it comes to health reforms and the health sector generally. Now, tough time of the year to be unhealthy, of course. This is the time when there's more pressure on the health system. But yeah, perhaps some issues to do more with budgets and with structural issues, and how much of the new structure of the health system to keep in the change of government. Joining us on the program now, Bryce Edwards. Kia ora, good morning.
Morena, Andrew. In fact, I'm a victim of the health system or of health. Bit of a croaky throat, so bear with me if I cough.
And hey, it'll take you 3 weeks to get an appointment at the doctor's. That's
Yeah.
just the situation at the moment. It does seem to be more difficult to access healthcare, and I think there's a general feeling amongst the people. Look, even if we can't measure it, it just seems like it's trickier to get the healthcare you need when you need it, especially if you live in provincial or rural New Zealand.
Oh, I've got no doubt that the word for this is crisis.
Yeah.
Uh, there's parts of the health system that are working very well, and amazing people in the health service, in the hospitals and so forth. But things are very stretched in certain parts of it, and I've got no doubt that the last Labour government did the right thing in looking to restructure, to reform it. And they carried out these major centralisation reforms.
Yeah.
And now we're arguing really about whether they got it right, whether they did these reforms correctly. The new government, are arguing they didn't,
Mm-hmm.
or whether, on the other hand, Labour arguing that health is being underfunded by this government and that the crisis we're seeing in terms of short staffing, etc., is due to the current government. I sort of think they're both right to some extent.
Yeah.
Certainly, those reforms that Labour implemented from 2022 onwards were somewhat botched. And I think National's right to take a look at what went right and what went wrong. There were always questions about implementing major, huge restructuring
Yeah.
during a pandemic. And I think Labour did underestimate how big their ambitions were and
Yeah.
what was needed to combine 20 DHBs into one, just
Yeah.
kind of overnight almost. But also, I think that Labour is quite correct that there's problems the way National have now taken over, and there is a real sense in which maybe, the health system is still underfunded.
I mean, it is a significant proportion of the government's budget between
Yeah.
health and welfare. That is most of what New Zealand's tax dollars are spent on. There seems to be a little bit of arguments back and forth as to whether or not there's currently a hiring freeze on the health
Yeah.
sector. The government says no. There's all sorts of examples popping up of saying, well, we were told that we're not allowed to hire anybody this month in different parts of the sector.
Yes, well, clearly it's the cost of employing surgeons through to, cleaners
Yeah.
that is the big, huge cost in operating a health system. And, they've had to keep some containment on those costs.
Yeah.
Over the last few years, there's been shortages in lots of areas. So what we've seen, in fact, since the government's taken over, is that the new health system has employed a lot more nurses.
Mm-hmm.
So that's one thing we can be clear about. They've gone out, they've done a big recruitment campaign, they've brought in nurses from overseas.
Yep.
They've done particularly well. And Health New Zealand itself says we've actually ended up employing more nurses than we expected.
Mm-hmm.
And that's part of the reason for this so-called budget blowout. But there's all sorts of unevenness in the system.
The nurses want to live in the big cities where the infrastructure is, not in the regions where there isn't,
Yep,
right?
I think that's true. The same with doctors.
Yep.
And we are short of lots of specialist doctors throughout the country. In fact, that's happening throughout the world. There's a bit of a global crisis at the moment with just not enough clinical health specialists. And so there is no freeze on hiring at the moment in Health New Zealand officially,
Mm-hmm.
but in reality, yes, it seems that there is clearly an informal freeze in certain areas. And so yeah, it's a bit of a unfortunate situation where you have hospitals such as in Dargaville, where there's currently no doctor,
Yeah.
um, overnight at least.
Hmm.
And so, and there's other similar situations around the country. So, Health New Zealand is having to manage with, not enough doctors, resources. The government's kind of struggling. Or yes, we're putting in more funding into these areas, but it's clearly not enough because inflation's going up so quickly. We've had lots of population growth,
Yeah.
and in fact, we're finding out that as the population ages, because our demographic is getting a bit older,
Hmm.
that we're in need of more complicated, health needs in the hospital system, and we're coming up with more drugs, more
Yeah.
technology. So, yeah, health is becoming a bigger and bigger thing.
And this is one of the areas where I think perception becomes reality. If generally the population feels, gosh, I can't see my doctor. I've been on a waiting list for this procedure
Yeah.
for a long time. I'm seeing these stories in the news about other people in the same situation as me. Regardless of whether or not the government is spending a lot more money and doing what they can with what
Yeah.
they've got, the political tide seems to be going the other way.
Look, I think that's absolutely the case. And sometimes when governments do make good reforms, it takes a long time for these things to flow through until you've got, um, you see on the ground the benefits of that.
Yeah.
And I think Labour would be arguing at the moment, well, our reforms, we still haven't seen the benefits of them. Um, yeah, and maybe there's some truth in that. And likewise, like National are now saying, well, give us some time,
Yeah.
Yes, things are in crisis at the moment, but we've only just taken over. We'll fix things. But certainly, I've forgotten my point now, Andrew. I
Well,
was going to argue.
it was about perception, really, and whether or not these policies are going to stick when it comes to the way in which the public are
Well,
perceiving it.
I think there's going to be a lack of public confidence, I think, in who's in charge at the moment. And that's partly because the government itself says we don't have confidence
Yeah.
in Health New Zealand. We've sacked their board,
Hmm.
we've brought in a new commissioner, um, and both the Prime Minister and the Minister of Health, Shane Reti, are sort of being guarded in their what they say about their confidence
What
in
do you think
the
about
Health
his
New Zealand.
performance, particularly in the last week? Because, I mean, yes, having a medical professional as the health minister, that's a good start. And a Māori one, perhaps extra points for that. However, his performance, particularly fronting media, telling the story, conveying confidence, what's your impression?
I've always had a high regard towards Dr. Shane Reti, and I've always thought he's one of the understated stars of the National Caucus. Um, some people have talked about him as a future leader. I'm not quite sure that he's got that sort of leadership skills. He's not really a front person in the way that, Luxon uh, or other prime ministers have been.
Yeah.
Um, but yeah, I think my confidence has been dented in his performance over the last 2 weeks. Uh, he doesn't really give me the sense that he's on top of the game,
Yeah.
and some of his messages are quite questionable. And so, when he's talked about how there's 14 layers of bureaucracy between the patient and the top of Health New Zealand,
Hmm.
once people started delving into that, digging in to work out if that's true, it didn't really quite pan out.
Yeah. Yeah.
And so there's been a few questionable statements from the minister.
And now, I suppose this is a bit of a two-edged sword, but of course, early in the term, the government said, hey, we're going to put some measures in place. We're going to put some big, audacious goals down, and we're going to say, measure us against these. And particularly in the health sector, it was like five impossible things to do before breakfast, really. You can be confident, but at the end of the day, people will
Yeah.
judge this government and the performance of their policies on these measures. Have they set themselves up to fail, Bryce?
Maybe, and I mean, I think it's heroic and it's admirable that they have put in some targets, and it's one of the things that the last Labor government, especially in health, but our other areas, weren't willing to do.
Yeah.
And I think that did lead to problems because if you don't have targets, you don't have accountability,
Hmm.
you've got no way of measuring how things are working. So National's doing the right thing with that. As to whether they got those targets right or not, if they're too ambitious, I'm not sure, but. it's a good way for us to measure what's going on. And yeah, when the likes of you and I go into emergency departments with our kids or whatever, and it takes 8 hours to be seen, that flows into those stats. And at the moment, I think it's something like 70% of people that go into ED get seen within 6 hours, and they're trying to get that figure higher so that everyone's seen within 6 hours. And it's clearly not happening, but no, I think it's the right thing to do.
Well, always appreciate your comments. As always, do help that your personal health improves throughout the week. Bryce,
Yes.
kia ora, thanks for your time today.
Cheers. Thanks, Andrew.
Hey, thanks very much for joining us in the Rhema studio. Thanks very much for watching the interview. It's kind of nice to have an audience, actually. And if you did like what you watched, then do give us a like, do give us the thumbs up. And if you'd like to see more interviews like that one, or perhaps even better, subscribe and those interviews will come straight to you. Don't forget to turn on your notifications, and we'll see you in the next one. Cheers.